Hi guys, it's me, Professor D, and welcome back to my YouTube channel. So guys, I know this video already looks different. My background is different. I am in Chi-Town, Chicago, Illinois. Before I even get started, if your cohort or your nursing program would like to book me, I can be reached at nexusnursing@gmail.com. Once again, that email address is nexusnursing@gmail.com. Okay, so this video, guys, I'm going to be covering pharmacology. You know what I'm about to ask you to please support this channel. How can you support this channel? One, by liking and subscribing to this video, to my channel, and sharing my content. I get so many emails, Professor D, you helped me pass my NCLEX, you helped me with this test, I really appreciate you. Well, if you appreciate me, you can show it by sharing my content. Share my content on your Facebook, on your Instagram, on your TikTok, on your social media with friends or coworkers that are either in the nursing program or thinking about the nursing program, or you think they need to go into the nursing program. Send them a sample, help my channel grow if you appreciate the content that I deliver to you every week. Don't forget, guys, besides YouTube, I'm also on TikTok, I'm on Instagram, I'm on Facebook. My handle across all of the social media platforms is Nexus Nursing. Okay, guys, so without any further ado, let's get started. First question. A nurse is preparing to administer furosemide to a patient who's in the hospital with heart failure. Which of the following should the nurse consider when administering this medication? A, give the dose first thing in the morning. B, do not administer the medication with meals. C, monitor the patient's temperature every 4 hours. Or D, decrease fluid intake to avoid excess urine secretion. And guys, the correct answer is A, give the dose first thing in the morning. So let's talk about this. First of all, furosemide is what? Lasix. What is Lasix? Lasix is a potassium losing diuretic, okay? Lasix, losing potassium. So when a patient urinates, they're losing potassium through the urine. You have to remember that, guys, because you'll get lots of questions on that. So anyway, why are we giving this diuretic in the morning? The reason we give patients diuretics in the morning is because we don't want them waking up in the middle of the night to use the bathroom. Think about it. You just wake up from sleep. Aren't you groggy? Aren't you a little bit confused? Now this patient who's a little bit confused is trying to get to the bathroom. What might happen? They might have a fall. They might have an injury. So it's very important to give the diuretics in the morning and to teach the patient to take that diuretic medication in the morning. All of the other choices are incorrect, guys. Next question. Which of the following medications is classified as a Schedule I controlled substance? A, heroin, B, oxycodone, C, Tylenol with codeine, or D, methylphenidate? And guys, the correct answer is 1, heroin. So when it comes to Schedule I drugs, guys, if a medication is Schedule I, that means there is absolutely no reason medically for this medication to be given. Okay, there is no reason for that medication to be given medically, and no prescriber, no doctor, no practitioner, no prescriber should be prescribing that drug, I should say, such as heroin. It has no therapeutic value, okay? Let's look at our other choices. 2, oxycodone, that's a Schedule II. Tylenol with codeine, that's Schedule III. And methylphenidate, that is Schedule II, okay? Next question. Oh, by the way, your oxycodone and your Tylenol with codeine, both of those are opioids. Those are opioid narcotics. And choice D, the methylphenidate, that's a CNS stimulant. Next question. The nurse receives the following order from a physician. Give macrobid by mouth 3 times a day with meals. Which of the following elements is missing from this prescription? A, the dates to give the medication, B, the dose of the medication, C, the patient's allergies, or D, the patient's response to the medication. And guys, the correct answer is B, the dose of the medication. It says macrobid by mouth 3 times a day. How much macrobid are we going to give? Are we going to give 1 milligram or 100 milligrams, right? So that's what's missing. A nurse is attempting to read a medication order in the patient's chart, but the physician's handwriting is illegible. The nurse contacts the physician to clarify the order. Which of the following must the nurse document? A, none. The nurse should leave the order as is. B, clarification from physician. Give acetaminophen by mouth, XYZ. C, unable to read, order canceled. Or D, illegible. And guys, the correct answer is B, clarification from a physician, give acetaminophen by mouth, XYZ. So guys, you are going to document that you reached out to the physician, that you clarified the order, and this is what the order says. Now let's look at the wrong answer choices. A says none. The nurse should leave the order as is. Well, if you leave the order as is and it's illegible, how are you going to give the medication? How do you know what to even give? So that's wrong. C, unable to read order canceled. You don't have the power to cancel an order. If the doctor wants an order to medication to be given, you need to give that medication. So you're going to seek clarification. Choice D, illegible. Really? Illegible and what? So guys, in nursing, you've learned this. When there's a problem, you're going to do what? Intervene. You're either going to intervene by reassessing. You're going to intervene by asking questions. You're going to intervene by doing something, but you can't just leave a problem there to be a problem. You must do something about it, and that's why B is the correct answer. Next question. A patient's taking Parnate, which is classified as a MAOI. Which of the following foods should the nurse counsel the patient to avoid? A, cottage cheese, B, chicken, C, green beans, or D, sauerkraut. And guys, the correct answer is D, sauerkraut. So you have to remember, guys, with these MAOIs, the patients absolutely must avoid foods that contain tyramine because that can place the patient in a hypertensive crisis. So foods that contain tyramine are like deli meats or fermented meats or aged cheeses. And let me tell you, this is a famous NCLEX question where they'll try to trick you and they'll put cottage cheese, wanting you to jump on that cheese and choose that as the answer. But cottage cheese is not aged cheese. So that is safe for a patient who is taking an MAOI, but sauerkraut is not. It contains tyramine, okay? And by the way, patients who are taking MAOIs, besides the aged cheese or the foods with tyramine, they need to stay away from red wine, alcohol, and that goes across the board for any psych meds that the patient needs to take, stay away from alcohol, okay? Next question. A nurse is teaching a patient about the possible side effects associated with his new prescription for amitriptyline as treatment for depression. Which of the following information should the nurse provide for the client? A, the medication may cause hypertensive crisis. B, the medication can cause dry mouth and blurred vision. C, the medication will cause difficulties in sleeping. Or D, the medication increases urinary output. And guys, the correct answer is B. The medication could cause dry mouth and blurred vision. So this is amitriptyline. So amitriptyline, guys, that is a tricyclic antidepressant. Remember, those tricyclic antidepressants causes anticholinergic-like symptoms. If you guys been following me, you saw my video that I did on anticholinergics. Don't forget the poem that I taught you, anticholinergics. Can't see, can't spit, can't pee, can't see, blurred vision, can't spit, dry mouth, can't pee, decreased urination, because remember all of their secretions are being dried up, can't, constipation. So that's why B is the correct answer. Now let's look at our other answer choices. A, the medication may cause hypertensive crisis. Well, I just talked to you guys about that. We know that goes with what? MAOIs. And C and D, those are just wrong. They just made that up and just added those to the choices. Next question. A client's been prescribed paroxetine Paxil while in the hospital. Several hours after receiving the first dose, the patient becomes confused and agitated, and he starts sweating and having hallucinations. Which of the following best describes the most likely cause of this reaction? A, anaphylaxis, B, serotonin syndrome, C, infection, or D, withdrawal syndrome. And guys, the correct answer is B, serotonin syndrome. So let's look at this medication, paroxetine Paxil. That is an SSRI. Whenever you guys see a test question about an SSRI, the very first thing you need to have going on in the back of your mind is serotonin syndrome, because those are one of the biggest concerns that we have because it's life-threatening. Okay, so we're going to be watching out for those signs and symptoms, and it's right here, guys. Confusion, agitation, sweating, hallucinations. Something else the patient may have, they may have tremors and fever. And when I say fever, high fever, I'm talking about life life-threatening fever. So that's why B is the correct answer, serotonin syndrome. These are the signs and symptoms that we're seeing that we're concerned about. Now, let's look at our other answer choices. A, anaphylaxis. No, anaphylaxis is life-threatening, but it's a life-threatening allergic reaction. And what we're seeing here is not an allergic reaction. These are signs and symptoms of serotonin syndrome. C, infection. No, you guys know what infection is. With infection, we may see inflammation at the site. We may see purulent drainage, stuff like that, high fever. That's not what we're seeing here. And D, withdrawal symptoms. So withdrawal symptom, these are symptoms we see when a patient is discontinuing or has discontinued a medication that they have a physical dependence on. And that's not the situation that's given here. So the correct answer is B, serotonin syndrome. Next question. A patient who's receiving heparin for a history of blood clots has developed heparin-induced thrombocytopenia. The platelet counts 90,000. Which of the following nursing interventions is appropriate in this situation? A, continue to administer the heparin as scheduled and monitor for complications. B, administer half the dose of heparin instead of the full amount. C, give protamine sulfate to counteract the heparin. Or D, hold the heparin dose and contact the doctor. And guys, the correct answer is D, hold the heparin dose and contact the doctor. If you go to the question, it says that the patient has 90,000. That's the platelet number. Okay, guys, your normal platelet number is 150 to about 450,000. 150 to 450,000. This patient only has 90,000. Okay, and in the question, they tell you that the patient has heparin-induced thrombocytopenia. Thrombo, clot, cyto, cell, penia, what? Little bit of clots, little bit of clot cells, which is what? Your platelets. So this patient is at risk for bleeding. We're going to call the doc. We're going to withhold the medication first, call the doctor, and most likely what is the doctor going to order? Protamine sulfate, because protamine sulfate is the antidote for heparin toxicity, but we can't give that without a doctor's order. And look how they try to trick you. They wanted you as a student to jump to C. How are you going to give that antidote without the order? And that's number one. Number two, so you're just going to keep that medication that's killing them. You're going to keep that in that patient's system while you're giving them the antidote. That makes no sense. You're going to withhold the medication, call the doctor, and get new orders, which is most likely going to be the antidote. Okay, now let's look at the wrong choices. A, continue to administer the heparin. I just told you. If you choose that answer of continuing to administer what's killing the patient, what you're doing is letting the test writer, you're letting NCLEX know that you're completely clueless. You have no idea what's going on, and you're a killer and you're clueless. You're clueless because you don't know what's going on, and you're a killer because that's exactly what you're doing, killing your patient. Okay? Choice 2, administer half the dose. Excuse me, are we playing doctor? I hope not. You're not going to give half the dose. You're not the doctor. You have to call the doctor to get an order, and I'm pretty sure the order is not going to be half a dose. Anyway, moving on. C, I told you why that's not the answer. We expect protamine sulfate to be ordered, but that's going to be after you call the doctor, obviously. Choice D is the correct answer. A nurse is caring for a patient who has angina. The nurse knows that he has a prescription for nitroglycerin sublingual tablets. Based on the nurse's understanding of this medication, the nurse knows that this medication works by A, preventing blood clots in the lower extremities, B, minimizing atherosclerotic plaques to improve blood flow, C, dilating blood vessels and increasing venous return, or D, increasing blood pressure to improve cardiac contractility. And guys, the correct answer is C, dilating blood vessels and increasing venous return. That's exactly what nitroglycerin does. It dilates those blood vessels. I can't speak, guys. It dilates those blood vessels so that oxygen-rich blood can get to what? The heart, and decrease the angina. Because remember, the reason that patient's having that pain in their heart, they're having that angina, it's their heart screaming out for oxygen-rich blood. And so when the patient puts that nitroglycerin under their tongue, immediately it should cause vasodilation and more oxygen-rich blood flows to the heart muscles. Okay, let's look at the wrong answer choices. A, preventing blood clots in the lower extremities. No, those are antiplatelets to do that. B, minimizing atherosclerotic plaques to improve blood flow. Those are actually cholesterol lowering agents that do that. And choice D, increasing blood pressure increasing blood pressure to improve cardiac contractility. Actually, vasopressors do that. Like if a patient is, this is life-threatening or they're severely hypotensive, they may get vasopressors to bring up that patient's blood pressure, okay? So the correct answer is C. Next question. Which of the following best describes the action of a beta blocker as cardiac medication? A, decreasing preload to reduce the work of the heart. B, increasing sodium and water absorption. C, impeding sympathetic nervous system to reduce vasoconstriction. Or D, regulating the cardiac conduction system to stabilize heart rhythms. And guys, the correct answer is C, impeding the sympathetic nervous system to reduce vasoconstriction. So guys, another word for impeding is to stop, to block. And that's exactly what it does. It blocks the sympathetic nervous system. Whenever you guys see sympathetic nervous system, I want you to think of two things. I want you to think of speeding up, as in speeding up the heart rate, speeding up the blood pressure, and squeezing, vasoconstriction. When vasoconstriction happens, what does it do? Bring up the blood pressure, right? So beta blockers impede, or they block the squeezing of the vessels, which would have made the blood pressure go up. And it blocks or it impedes speeding up of everything, such as a heart rate or the blood pressure. So what does it do? Bring down that blood pressure. It can do what? Bring down that heart rate. Okay, so C is the correct answer. Excuse me, guys. All of the other choices are incorrect. Okay, next question. Which of the following is an example of an antifungal medication? A, nitrofurantoin. B, fluconazole. C, azithromycin. Or D, levofloxacin. And the correct answer is B, fluconazole. So guys, and usually the antifungals end in what? Zole. So that should have been your first clue, okay? All the other choices anyway, guys, are antibiotics. Nitrofurantoin, your azithromycin, levofloxacin, all of those are antibiotics. The only one here that is an antifungal is that one that ends in the zole, the fluconazole. And usually fluconazole is given for obviously fungal infections, but the type, usually yeast infections or if patient has thrush. Which of the following is an example of a topical agent that may be applied for arthritis relief? A, lanolin. A, lanolin. B, zinc oxide. C, dexpenthenol. Or D, capsaicin. And guys, the only correct answer here is D, capsaicin. So guys, it's made, this medication, you put it on the skin and it's made from chili peppers. So what happens is when you put it on the patient's skin, it gets absorbed and it goes directly to the pain receptors. It acts on the pain receptors, and what it does is block or diminishes the signal to the brain telling you that you're in pain. And that's how it works. All of the other choices, guys, A, B, and C, all of these treat skin irritation, not arthritis or arthritis pain. Next question. A patient requires long-term systemic corticosteroid therapy for treatment of skin disease. Which of the following effects has been associated with chronic use of corticosteroids? A, weight loss. B, increased blood glucose levels. C, hypotension. Or D, hair loss. And guys, the correct answer is B, increased blood glucose levels. So you guys absolutely must know this, guys. When it comes to steroids, our three biggest concerns is 1, hyperglycemia, because it will raise your blood sugar. 2, fractures or osteoporosis, because they tend to make the bone what? Porous. And 3, infection. Remember, what do steroids do? They mask the signs and symptoms of infection. So these are the 3 biggest concerns. The minute you see a patient that's on a steroid, those are the 3 biggest concerns that need to already be going on in the back of your mind. Now let's look at our other choices. A, weight loss. Absolutely not. If anything, steroids will cause the opposite, weight gain. Choice C, hypotension. Nope. If anything, it's going to do the opposite, make the blood pressure go up. And D, hair loss. Nope. If anything, it's going to make the patient grow hair. in places they don't want. So if you're a female, you're going to notice you start growing a mustache or a beard, what's this known as hirsutism, and the hair is very coarse, very hard, very thick. Okay, so the correct answer is B, increased blood glucose levels. Which of the following is an example of a rapid-acting insulin? A, Lispro, B, Humulin N, C, Novolin R, or D, Detamir? And guys, the correct answer is A, Lispro. Guys, this Lispro starts working within 15 minutes of injection, right? So what does that tell us about this medication? By the way, whenever you guys get a question on insulin and they're asking you, they're talking about the onset of the medication. What they really want to know is, do you know when this medication starts working, so you can know what? When you're going to look out for those signs and symptoms of hypoglycemia, and when do you expect to feed the patient? So a medication such as Lispro, you better make sure that that food is right there, right? You're not going to wait for that food to come down, because you give that medication starts working in 15 minutes, but there was a holdup and the patient doesn't get their food in 30 minutes, an hour. You're in trouble, right? Okay, so let's talk about the other answer choices. B, Humulin N. This is intermediate acting. It starts working about 2 to 4 hours after administration. C, Novolin R. This is fast acting. It starts working within a half hour after injection. And then Detamir, guys, that is long acting. And remember, our long acting, guys, like the Lantus, what does it do? It has a steady secretion of insulin. Okay, there is no peak. It lasts for about 24 hours. So the correct answer, our rapid acting, very fast, right? Within 15 minutes is our Lispro. Next question. Which best describes the medication administration process of an insulin jet injector? A, the syringe contains a pre-filled cartridge which is administered by sticking the needle under the skin and pressing a button. B, the injector is connected to a port under the skin that provides a continuous infusion of insulin. C, the patient wears a catheter that's attached to an area of the mucous membranes and the insulin is absorbed. Or D, the insulin is injected directly through the skin without the use of a needle. And guys, the correct answer is D. The insulin's injected through the skin without the use of a needle. And that's absolutely true. What happens is that medication goes through the skin and goes directly to the subcutaneous fat where it gets absorbed. But something that's very important, you have to still teach the patient, even though there's no needle involved, the patient can still experience pain and bruising. So you want to teach that to the patient. All the other answers are incorrect. There is no needle. Choice D is the correct answer. Next question. Excuse me, guys. A nurse prepares a dose of medication that is a controlled substance to give to a patient for pain. When the nurse takes the medication into the room, the patient refuses it. What action of the nurse is most appropriate? A, encourage the patient to take the medication and explain that it has already been signed out to him. B, return the medication to its former packaging. C, label the medication for use and return it to the locked cupboard so someone else may use it. Or D, discard the medication according to facility policy and document the patient's refusal. And guys, the correct answer is D. You're going to discard that medication because you already took it out. You can't put it back. You can't give it to somebody else. You're going to discard the medication according to the facility policy and document that the patient refused. Let's look at our other choices. 1, encourage the patient. Stop right there. Number 1, pain is whatever the patient says it is. And number 2, patients have rights. Okay, so before you encourage a patient to do anything, which, in some cases you do encourage a patient to do something, but before that, you do what? You assess, you find out what the issue is, what's stopping them from doing something before you encourage them to do something that they should be doing. So that's wrong. B, return it to its former packaging. No, you already took it out. C, label the medication for use. Absolutely not. That patient refused the pain med. You are going to discard it. You're going to discard it with another witness because you're not going to have the facility come accuse you of, taking patient's meds. So you're going to have to do it with another nurse according to the facility policy and document that patient refused. Okay, guys. Believe it or not, we are already down to our very last question. A nurse needs to administer a medication that requires a tablet to be split in half. When splitting the tablet with the pill cutter, part of the tablet breaks so that it's not cut exactly in half. Which of the following should the nurse do in response? 1, choose a side that appears to be close to 1/2 of the doses prescribed. B, contact the pharmacy and request a different pill cutter. C, measure out half of what is left of the medication, crush it to administer 1/2. Or D, discard the medication and choose another tablet. And guys, the correct answer is D. You're going to discard that medication and choose another tablet to cut in half. You have to be the safe nurse. You can't guesstimate, guys. And even if you got another pill cutter, so what? The one that you were the pill that you were using, the tablet is already cut. What, you going to cut it again? No, you're going to discard that, get a fresh pill and cut it correctly. You always want to be a safe nurse. Guys, I hope that you found this video to be helpful. If you did, please do not forget, like this video below, subscribe to my channel. Let me know in the comments what you thought about this video. If you'd like to see more pharmacology, if you'd like to see something else, please leave it in the comments. I'll make sure I shoot that video out for you. Please don't forget to check me out on my other social media platforms such as TikTok, Instagram, Facebook, right? Also, don't forget, I have a podcast for nurse practitioners and nursing students called Nexus Nursing. That's the handle. And I'm on every major streaming platform. So you can find me, Nexus Nursing, just about anywhere. Guys, thank you so much for spending the time and watching this video. And don't forget to catch me on the next video.